Healthcare subsidies do remain the central issue Democrats want addressed in a funding bill.
Tonight, we're looking into one of the key disagreements in our nation's capital that could ultimately affect some 23 million Americans.
With no end to the government shutdown in sight, federal workers pleaded with lawmakers today to sit down together and work out their differences.
For the sixth time, the Senate fails to pass a vote to reopen the government. The continued shutdown.
The Senate is back at it again with another round of votes today to end the federal government shutdown. With
air headlines now, the U.S. government has officially shut down.
Hello, everyone. Today, we're going to be tackling the real issues behind healthcare policy, costs, and your care with no-nonsense insights. I'm Dr. Adam Nessum, and today we're diving deep into one of the biggest stories that's gripping Washington right now, the government shutdown that's entering its second week as of October 9, 2025, as I'm recording this video. If you've been following the news, you know that headlines, federal workers furloughed, national parks closed, air traffic delays piling up. But beneath the surface drama, this shutdown boils down to a fierce battle over healthcare funding, specifically the extension of Affordable Care Act subsidies that are set to expire at the end of the year. Now, Democrats are digging in their heels, demanding that these subsidies be locked in as part of any deal to reopen the government. Republicans are pushing back, calling it a blank check for waste. And both sides are spinning this hard. Democrats say it's about protecting hardworking families from skyrocketing premiums. Republicans say it's about fiscal responsibility and cutting unnecessary spending. But here's the truth. Neither side is explaining it clearly. These subsidies and many core ACA policies aren't just failing to solve our healthcare crisis, they're actually driving up costs, crushing independent doctors, and padding the pockets of insurance giants and massive healthcare conglomerates. Today, we're going to break this down in plain English. We'll explain the shutdown, why Democrats are fighting for these subsidies, and most importantly, why extending them is likely pouring gasoline on a fire that's already burning your bank account. I've been studying healthcare policy for years, and some of my insights were inspired by recent expos from Dutch Rojas, who's the CEO of the Rojas Report and founder of Bilksum Health, who highlights how the ACA has tilted the system against patients and independent physicians. So stay with me. By the end, you'll understand the real issues. Be ready to ask your senators, red or blue, for solutions that actually work. So let's dive in. First, a quick explainer on the shutdowns because the news spin is exhausting. So the federal fiscal year ended on September 30th, 2025, and Congress failed to pass a budget or even a short-term funding bill, a continuing resolution, or CR as it's called, to keep the lights on. At midnight on October 1st, non-essential government operations shut down. That's over 2 million federal workers affected, from IRS staff to park rangers. As of today, October 9th, we're on day 9. The Senate has voted 5 times on dueling plans and all have failed. Republicans with slim majorities in both chambers want a clean CR funding the government through November 21st at current levels with no extras. Democrats counter with a shorter CR through October that includes extending those ACA subsidies. Senate Minority Leader Chuck Schumer called it a Republican-driven shutdown, blaming their refusal to negotiate on health care. Senate Majority Leader John Thune fired back, saying Democrats are holding the government hostage over partisan demands. And the impacts are very real. The IRS furloughed nearly half its staff on October 8th, delaying tax processing. Air traffic controllers are stretched thin, causing delays at major airports like Houston, Newark, and Boston. And military families face delayed paychecks next week unless this resolves soon. But why the deadlock on ACA subsidies? This hits home for millions of Americans. These are enhanced premium tax credits under the Affordable Care Act, also known as Obamacare, that helps middle-income folks buy insurance on the marketplaces. Now, this was boosted during the pandemic and extended through 2025 via the Inflation Reduction Act, and they're worth about $60 billion a year. Without extension, experts say that the premiums could jump 75% or more for some plans in 2026. A family of 4 earning $89,000 might see their monthly bill go from $500 to $2,000, which would be a 300% hike, as Senator Amy Klobuchar warned. Democrats like Senators Hirono, Gallego, and Klobuchar frame this as a lifeline, especially in rural, Trump-won states where 3/4 of the marketplace enrollees live. Now, they're saying that Republicans prioritize billionaires over families. Ruben Gallego tweeted, "Groceries, rent, utilities, everything's too expensive. And Republicans plan, jack up your healthcare insurance premiums by hundreds, maybe thousands of dollars." Now, it sounds like a strong case, protecting access, shielding the vulnerable, but here's where my research shows a different picture. These subsidies aren't just a lifeline, they're corporate welfare. Every subsidy dollar flows a predictable path. It doesn't go straight to your doctor or your care. It flows through insurers like United Healthcare, Centene, Elevance, Humana, CVS Health. These giants collect the premiums, hold the cash as a float, which is free money that they invest for years, and earn billions while claims trickle out. United Healthcare has a $500 billion market cap, profiting on insurance, PBMs, and providers, all subsidized. Centene gets 70% of its revenue from government contracts. Even Wall Street giants like Berkshire Hathaway, JP Morgan, BlackRock, and Vanguard benefit, turning those premiums into investments in stocks, bonds, and even railroads. Congress keeps the cycle going with donations from these players. Okay, so here's my take. Subsidies don't create access, they create assets. Patients get coverage, but not always care. Premiums rise because insurers know that the government will cover the bill. It's a problematic cycle. Citizens rely on the handouts, corporations on the cash flow, politicians on their donations, and in the end, these subsidies really line the pockets of Wall Street. So extend them, and more profits for insurance, more mergers for systems like Optum. And it's not just subsidies. The ACA's core policies have supercharged this mess. Let me break them down based on my research. So number one, the ban on physician-owned hospitals. This is ACA section 6001, and it's a major problem. I call it anti-competition written into law. Before 2010, doctors could invest in and build hospitals in underserved areas like rural hotspots and high-need communities. These facilities actually charged 18% less for procedures per Johns Hopkins data, with better outcomes. But the ACA froze expansion and banned new ones. Why? Well, lobbying from the American Hospital Association and big systems. They claimed it prevented overbuilding, but fewer hospitals don't lower prices. That defies basic economics. So the result? The supply is choked, prices go up, and independent physicians are out. Today, 50 states ban physician ownership. Felons and private equity can own hospitals, but the doctors who run them, they can't. And systems like Banner Health buy practices cheap, rebill at hospital rates at 2 to 5x higher, and pocket the difference tax-free. Same procedure, same doctor, different building code. Premiums soar because costs do. Number two, site of service differentials. No neutral payments. So Medicare pays hospitals 2 to 5 times more for the same service as independent offices. A colonoscopy can cost $1,500 at an independent practice and $4,000 at a hospital outpatient department. The medicine doesn't change, just the billing code. This facility fee arbitrage funds acquisitions of independent doctors. 70% of doctors in 2010 were independent. To today, it's only around 20%. Systems also hoard billions tax-free, pay executives millions, while independents struggle. The ACA banned physician-owned hospitals, protected non-profit tax breaks, and added paperwork, and then acted surprised when premiums spiked. So no site-neutral payments, no fair competitions. Again, costs go up, choices go down. Number three, PBM issues, the pharmacy black hole. Pharmacy benefit managers like OptumRx and CVS Caremark thrive under the ACA. Subsidies boost prescription volume and PBM skim rebate spread. So they keep 10 to 30% in kickbacks while raising prices. More subsidies mean more volume, more hidden profits. They sell your medicine back to you at a markup that the government pays for. Essentially, PBMs turn rebates into cash flow for insurers, not savings for you. Premiums include this bloat. Pharmacy costs are 20 to 30% of the total. Number four, consolidation and independent doctor squeeze. The ACA didn't just allow mergers, it encouraged them. The Stark and anti-kickback laws, which were meant to curb corruption, now let systems pay doctors for intra-system referrals, while independent doctors risk actual jail time for the same offense. Health systems can pay essentially their primary care physicians for referrals, but private practice specialists can't do that if they're not in the same system. Also, add in certificate of need laws in 34 states, which require permission to build a clinic advised by incumbents. This is like saying if Delta had to approve JetBlue's flights. The result? Monopolies. 20 to 25% higher premiums in CON states and fewer rural clinics. Independents get no 340B discounts, no DSH payments, no GME funds. The independent private physician is excluded by design. Medicare cuts, about 22% since 2001 for independent doctors when adjusting for inflation, while hospital payments rise. It's death by 1,000 cuts. So the big picture, why is it not working? The ACA claims to promote competition, but it does the opposite. It lets employers choose from a handful of government-approved insurers, mandates coverage for everything under the sun, and pours billions in subsidies to prop up premiums without capping the profits of insurers or hospitals. Instead, it regulates provider networks, locking patients into limited choices. This isn't a free market. It's a system where the government picks winners, big insurers and health systems, and patients and independent doctors lose. The subsidies fuel the cycle, inflating costs while access shrinks, especially in rural areas where hospitals are closing. Folks, this isn't about left or right. It's about what's right for us. Democrats push subsidies because their donors, insurer systems benefit. Republicans oppose spending, but dodge the real drivers: bans, biases, PBMs, these laws that we've discussed. Both sides keep the system broken. So what's my plan that can actually fix the system with hopefully a safety net as well? We need a healthcare system that puts patients and doctors back in control, with a true free market and a safety net for those who truly need it. Here's how. Number 1, site-neutral payments. Pay the same for a procedure, whether at a hospital or independent physician office. No more 2 to 5x markups for the same care under Medicare. This will allow independent physicians to take more Medicare in general. 2, lift the physician-owned hospital ban. If doctors can build affordable facilities in rural and underserved areas, this will ultimately lower costs with increased competition. 3, repeal certificate of need laws. Stop forcing clinics to get permission from competitors to open. More providers means more competition, which ultimately means lower prices. 4, end nonprofit subsidies. No more tax-free billions for hospital systems acting like corporations that are investing that money. Level the playing field. 5, enforce PBM transparency. Make pharmacy benefit managers disclose rebates and past savings to patients, not insurers. And 6, fund patients, not insurers. So for example, instead of $25,000 a year in subsidies for a family's premiums, give families $20,000 in a health savings account to pay cash for doctors, labs, and medications, often which would be 30 to 50% cheaper than insurance rates. Pair it with, let's say, a $5,000 plan for catastrophic coverage, protect against emergencies, and this empowers you to choose your doctor based on price and quality, driving competition. Cash pay options like direct primary care or transparent surgery centers are already slashing costs and popping up despite these laws. 7, safety net for the needy. For those who truly can't afford care, low-income families, and chronically ill, maintain a targeted subsidy program, but fund it directly to the patients. HSAs, not insurers, no middleman, and no skimming. Just help those in need. This approach hopefully cuts costs, expands access, and keeps independent doctors in business while ensuring no one falls through the cracks. Okay, we covered a lot in this video, and did everything I lay out, is it going to be perfect policy? It's hard to say. Every policy comes with drawbacks, but I think it's directionally accurate and can really slash costs overall. So I think hopefully this arms you, the viewer, with the information about what's actually going on in the healthcare system today and why we really need a full overhaul of this system. This is my thoughts. I'm open to being challenged. No problem at all. Leave it in the comments below, and I'll see you in the next video.